they may not be able to identify or answer the questions if it is twisted. So I thought of asking at least straightforward questions, but I will not be affected. It is not a question of whoever is in charge of the course, they will be affected. But only thing is, by keeping in the mind the intelligence of the students, of particularly of this batch, I may have to ask somewhat straightforward questions. Otherwise, I'll get the curse from not from you, from your parents and grandparents. I think they are not teaching, but they don't know the fact. Okay, you will tell your parents we have done, but a question was challenging, exam was challenging, and I think they may not have corrected it properly. And we will ask for re-evaluation. Again, parents have to pay the money for that. God bless you. Pectoralis major, identification, nerve supply. What is the nerve supply of pectoralis major? Medial and lateral pectoral nerves. Medial and lateral pectoral nerves. Okay. Identification of pectoralis minor. Pectoralis minor. Nerve supply of the pectoralis minor. Again, medial and lateral pectoral nerves. Some books may give only the lateral pectoral nerve. Okay, medial and lateral pectoral nerve. Some books give only the lateral pectoral nerve. So inserted to the third, fourth, fifth ribs at the costochondral junction. Okay, and subclavis is not there. Subclavis is not there in this, or in any specimen. They have not dissected the subclavius. Now, axillary artery can be asked. This is the axillary artery. Can you see that? Identify the tie structure. Identify the tie structure. What is it a continuation of? It is a continuation of subclavian artery. How does it continue, or what does it continue below as, or distally as? It continues as the brachial artery beyond the lower margin of teres major muscle. Okay, teres major muscle. Identify the tie structure, axillary artery. Mention the branches arising from its second part, because two branches are there, or third part. Identify the tie structure, name the branches arising from its third part, because unless we show how exactly it is divided, we cannot ask. So directly we have to ask. I can ask directly, name the branches arising from its third part. So first part, one branch, superior thoracic artery. Second part, two branches, lateral thoracic artery, thoracoacromial trunk. Third part, three branches, anterior and posterior circumflex femoral arteries, subscapular artery. Okay, so that's all about the axillary artery. Axillary sheath I may not ask, because you definitely will not tell that. Okay, so that's the axillary artery. Then I'll come to the back later. This one is the biceps brachii. Biceps brachii. The biceps brachii, identify the tie structure, biceps brachii, mention its nerve supply, musculocutaneous nerve. Identify the tie structure, biceps brachii, because one, if I ask identification, at least minimum you will identify the muscle. You may not tell the nerve supply, but identification wise you might identify the muscle, so that I can give half mark at least out of 1. So nerve supply is musculocutaneous nerve. Action brings about flexion and strong supinator of the forearm at the elbow joint. Strong supinator of the forearm at the elbow joint. So that is the biceps brachii. Okay. Coracobrachialis. Coracobrachialis. Identify the tie structure, coracobrachialis. Okay. Mention its nerve supply, musculocutaneous nerve. Musculocutaneous nerve. Okay. Then action, it brings about flexion. It brings about flexion and adduction, as to adduction. So it represents the adductor compartment in the lower limb. Adductor compartment in the lower limb. So identification, nerve supply. I can ask for coracobrachialis. But brachialis is important. this is the brachialis muscle. That's the brachialis. Deep to the biceps brachii, there is a brachialis. Identify the pin structure, brachialis muscle. Okay, brachialis. Mention its nerve supply. Did you say? This whole muscle is brachialis. Okay, that whole muscle is brachialis. Identify the tie structure or pin structure, pin muscle, brachialis. Mention its nerve supply, musculocutaneous nerve and radial nerve. Is a hybrid muscle. Such a muscle which is supplied by two nerves of two departments is called as hybrid muscle. Pinned muscle, mention its action, brings about flexion at the elbow joint, flexion at the elbow joint. So that is about brachialis. Identify the tie structure. Identify the tie structure. This one, brachial artery. Mention its terminal branches. So ulnar and radial artery. Identify the tie structure. Name the branches given off by it in the arm. Branches arising from it in the arm. Okay, in the arm, it gives, what are the branches? Superior ulnar collateral, inferior ulnar collateral, muscular branches, profunda brachii artery. Superior ulnar collateral, inferior ulnar collateral, muscular branches, profunda brachii artery. Clear? So that is the brachial artery. Now in this case, I may not ask in this specimen, because in this case, in this specimen, the artery is dividing at a higher level in the arm itself. It should divide in the cubital fossa. But here it is dividing in the arm into radial, that's a radial artery, and that is the ulnar artery. This is the ulnar artery. Okay, so that is about the front of the arm. So this is the ulnar nerve, this is the musculocutaneous nerve, this is the median nerve. Ulnar nerve, median nerve, musculocutaneous nerve. You can see there, musculocutaneous nerve. Okay. Then the one which is going behind is the radial nerve. Going behind is the radial nerve. Radial nerve. Okay. Okay, that's the radial nerve. Then when you see the back, this one is a deltoid. Identify the pin structure. Deltoid. Same on this one. Deltoid. Okay, identify the pinned muscle, deltoid, mention its nerve supply, axillary nerve, name its clinical, mention its clinical significance, use it for intramuscular injection, use it for intramuscular injection, name its or mention its actions. Anterior fibers bring about flexion and medial rotation, posterior fibers extension and lateral rotation, intermediate fibers abduction from 15 to 90 degree. 15 to 90 degree. Okay, so there is action of deltoid. Inserted to the deltoid tuberosity in the humerus. Inserted to the deltoid tuberosity in the humerus. Okay, deltoid tuberosity. So there is a deltoid muscle. Okay. Then you may have to come this side. This is the supraspinatus. That's the supraspinatus muscle. Supraspinatus muscle supplied by suprascapular nerve. It is supplied by suprascapular nerve and brings about initial abduction, 0 to 15 degrees of abduction. 0 to 15 degrees of abduction. Did you see? See the muscle? Please give way for 0 to 15 degrees of abduction. Okay, 0 to 15 degrees of abduction. That's the supraspinatus. Now this is the infraspinatus. This is the infraspinatus. Identification, nerve supply. Okay, in action. Identification, infraspinatus, nerve supply, suprascapular nerve, action. It brings about lateral rotation. Teres minor, identification, nerve supply, axillary nerve. Nerve supply is by axillary nerve. Action, again lateral rotation. Okay, this teres minor. So supraspinatus, infraspinatus, teres minor, teres major. Teres major, identification, teres major, nerve supply, lower subscapular nerve, action, medial rotation. Okay, teres major medial rotation, teres minor infraspinatus lateral rotation. Clear? So that is the three muscles. These muscles I may not ask. There is a levator scapulae, rhomboides minor, rhomboides major. Levator scapulae, rhomboides minor, rhomboides major muscle. Okay. Trapezius is reflected. There's a trapezius which is reflected. Trapezius. Okay. Okay. Trapezius can be asked. Identify the pin structure. Trapezius. Mention its development and nerve supply. Mention its development and nerve supply. Development is post sixth branchial arch. It develops from post sixth branchial arch. Nerve supply is by spinal part of the accessory nerve. Nerve supply is by the spinal part of the accessory nerve. So that is the trapezius. Okay. So trapezius, levator scapulae, rhomboides minor, rhomboides major, supraspinatus, infraspinatus, teres minor, teres major. This one is the latissimus dorsi. Latissimus dorsi. That's the latissimus dorsi. Okay. I may not ask because many actions are there, and it may be somewhat difficult for you to tell about other things. Anyway, I may not ask that, but identification wise you should be able to identify. This is the triceps brachii, and this triceps brachii, this is the long head, this is a long head, okay, this is the medial head, and there is the lateral head of the triceps brachii. Lateral head is deep, okay. So those things we may ask. Then quadrangular triangular space is maybe. Okay. Okay. Just see here. Identify the probed space. Identify the probed space. Identify the probed space. Quadrangular space. Quadrangular space. Mention its upper boundary. Upper boundary. Mention its upper boundary from before backwards. Subscapularis, capsular ligament of the shoulder joint, teres minor. Subscapularis in front, in between is capsular ligament of the shoulder joint, behind is the teres minor. Below is the teres major. Below is the teres major. Laterally surgical neck of the humerus, medially long head of the triceps. Medially long head of the triceps. So medially long head of the triceps, laterally surgical neck of the humerus, above subscapularis, capsular ligament of the shoulder joint, teres minor. Below is the teres major. This is the teres major. Okay, that's the teres major. Okay, so one or two questions I may have to ask bit difficult. Okay. Contents, what does it contain? It contains axillary nerve. Can you see the axillary nerve? Axillary nerve and posterior circumflex humeral vessels. Posterior circumflex humeral vessels are here. See that? Posterior circumflex humeral vessels and axillary nerve. Did you see that? Did you see? Please come. Posterior circumflex humeral vessels, axillary nerve. Did you see?
Yeah.
Come. Axillary nerve, posterior circumflex humeral vessels. Okay, they are the contents of space. I may not ask, but lower triangular space. This is the lower triangular space. Lower triangular space, bounded medially by the long head of the triceps, laterally by the radial groove, above by the teres major. Okay, above by the teres major, medially by the long head of the triceps, laterally by the radial groove or shaft of the humerus. What does it contain? Radial nerve and profunda brachii vessels. Radial nerve and profunda brachii vessels. Is it clear? So that is the lower triangular space. Lower triangular space. Identify the probed space. Identify the probed space. Mention its contents. Radial nerve and profunda brachii vessels. Profunda brachii vessels. So that is about the lower triangular space. Okay. Then one more muscle I forgot here. This one. Serratus anterior. Serratus anterior muscle. Identify the pinned muscle. Identify the pinned muscle. Mention its nerve supply, nerve to serratus anterior or long thoracic nerve. Name the clinical condition resulting from its paralysis. Winging of the scapula. Winging of the scapula. Okay, so that is the serratus anterior muscle. Then cubital fossa. Okay, in this here we can ask the muscles identification and nerve supply, mainly identification and nerve supply or action. See, this is the pronator teres. Okay, pronator teres from lateral to medial side. Lateral to medial side. There is a thumb. Lateral to medial side. Pronator teres. Pronator teres. Flexor carpi radialis. Flexor carpi radialis. Palmaris longus. Palmaris longus. Pronator teres. Flexor carpi radialis. Palmaris longus. Flexor digitorum superficialis. Flexor carpi ulnaris. Flexor carpi ulnaris. Can you see that? This is the flexor carpi ulnaris. Okay, I repeat. Pronator teres. Flexor carpi radialis, palmaris longus, here palmaris longus, sorry. Pronator teres, flexor carpi radialis, palmaris longus, flexor digitorum superficialis, flexor carpi ulnaris. Okay, deep muscles, flexor carpi radialis, is a flexor carpi radialis, flexor digitorum profundus, flexor digitorum profundus, okay, pronator quadratus, pronator quadratus, pronator quadratus. Here also you can see pronator quadratus. Can you see that? That's a pronator quadratus. This one, it is covered by membrane. Pronator quadratus. Okay. Now what is the nerve supply of these muscles? Pronator teres, all these superficial muscles, pronator teres, flexor carpi radialis, palmaris longus, flexor digitorum superficialis, supplied by median nerve, flexor carpi ulnaris is supplied by the ulnar nerve. Okay, and deep muscles, flexor here, flexor pollicis longus, flexor digitorum profundus, and pronator quadratus, all are supplied by median nerve. But I can ask this muscle, flexor digitorum profundus, identify the pinned structure or pinned muscle. Okay, mention its nerve supply. Medial half by the ulnar nerve, lateral half by the median nerve. Medial half by the ulnar nerve, lateral half by the median nerve. That is the flexor digitorum profundus. The flexor pollicis longus, this one, and pronator quadratus, both are supplied by median nerve. Clear? Okay, that is about these muscles. Radial artery, okay, radial artery, there is nothing much to ask. Now what about the extensor muscles? In the cubital fossa, we may not ask much thing because we don't have good specimen. Extensor compartment is very important, especially okay, brachioradialis, this is important, brachioradialis. Identify the pin structure, brachioradialis, mention its nerve supply, radial nerve, mention its action, flexion in mid-prone position. This is the mid-prone position. It brings about flexion at the elbow joint in mid-prone position. Okay, that's the brachioradialis. That's important. Then this one is extensor carpi radialis longus, extensor carpi radialis brevis. Okay, Brachioradialis, that is down, brachioradialis, extensor carpi radialis longus, extensor carpi radialis brevis. This muscle is very important because extensor carpi radialis brevis identification, extensor carpi radialis brevis, nerve supply, it is supplied by posterior interosseous nerve. These muscles, there is anconeus, brachioradialis, extensor carpi radialis longus, they are supplied by branches directly coming from the radial nerve. But here, this is supplied by the branch of the radial, there is a posterior interosseous nerve. There is extensor carpi radialis brevis. So, clinically it is important. Identify the tie structure, tied muscle, extensor carpi radialis brevis. Name the clinical condition resulting from injury to this muscle, tennis elbow. So if there is fracture of, tearing of few fibers of extensor carpi radialis brevis or damage to the radial collateral ligament results in tennis elbow. Okay. So please remember, this is the anconeus muscle. It's a weak extensor of the elbow joint, supplied by the radial nerve. Brachioradialis brings about flexion at the elbow joint in mid-prone position. Extensor carpi radialis longus, the name itself indicates it brings about extension at the wrist joint, supplied by radial nerve. Extensor carpi radialis brevis, supplied by posterior interosseous nerve. Okay. Then extensor digitorum. Can you see there? Extensor digitorum. Extensor digiti minimi. Extensor carpi ulnaris. So extensor carpi ulnaris, extensor digiti minimi, extensor digitorum, extensor carpi radialis brevis, extensor carpi radialis longus, brachioradialis anconeus. Okay. These are the superficial muscles. The deep muscles include abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, extensor indicis. Abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, extensor indicis. All these deep muscles, including the supinator is not dissected clearly here, supplied by posterior interosseous nerve. All these muscles are supplied by posterior interosseous nerve. Clear? So that is about the extensor compartment. Then going to the palm. This is very, very important. I can just put the pin, identify the pin structure. Flexor retinaculum. Since I said important, I hope you will read the answer for that. Attachment of the pin structure, flexor retinaculum, structures passing superficial to the pin structure. Attachment, when I say attachment, medial and lateral attachments. Mention its medial and lateral attachment. Identify the pin structure, mention its medial and lateral attachment. Name the structures passing superficial to it. Okay, medial 2 attachment, 2 structures, lateral 2 structures it is attached, and structures passing superficial, 3 structures. Clear? So there is a flexor retinaculum. That's important. That's very, very important. Then okay, this is another very important question. Identify the tie structure. Okay. Superficial palmar arch. Mention its termination or formation. How is it formed? Superficial palmar branch of the ulnar artery anastomosing with the superficial palmar branch of radial artery. That is normal way of completion of the superficial palmar arch. So identification is important. One. Second, I may ask name the different types or name the arteries which take part in the completion of superficial palmar arch. Yeah, it is vibrating, I know. Superficial palmar arch, how it is completed. Superficial palmar arch, how it is completed. There are three ways of completion of the superficial palmar arch. One, first and the most common, superficial palmar branch of radial artery. Second, arteria princeps pollicis artery takes part in the completion of the superficial palmar arch, or arteria radialis indicis. Okay, takes part in the formation, completion of superficial palmar arch. So all the three things you should know. Identify the tie structure, superficial palmar arch, how it is normally completed or usually completed by superficial palmar branch of radial artery. Name the different ways, different arteries taking part in the completion of the superficial, tie structure. Okay, tied arch, superficial palmar arch. So you have to remember three. Okay, then small muscles, definitely will break it and you will cut it, and next batch will tell there is no structure. So lumbricals, the lumbricals can be asked for the nerve supply. First two lumbricals by median nerve, next two lumbricals by ulnar nerve. Can you see the lumbrical here? So that's why what we usually ask is identify the tie structure or pinned muscle, mention its action, brings about flexion at the metacarpophalangeal joint, extension at the interphalangeal joint, flexion at the metacarpophalangeal joint, writing muscle. That's a lumbrical. First two lumbricals by median nerve, next two lumbricals by ulnar nerve, deep branch of the ulnar or just ulnar nerve. So that is about the arm here. To the joint, I don't know whether there may be a model of the shoulder joint where you can see the glenoidal labrum. Okay, and just see that if it is there, I can ask glenoidal labrum. Identify the pin structure, glenoidal labrum. What type of tissue it is made up of? Okay, it is made up of white fibrocartilage. Is it clear? Glenoidal labrum made up of white fibrocartilage. Okay, so that is about these muscles. Anything else I left? Anything else I left?